Assalamu alaikum. My name is Kiran Amir and I'm the Director of Operations at Parsa Eco Pakistan Super Hub. I would like to welcome you all to yet another Eco session in series of Liver Disease Eco. It's in collaboration with Pakistan Society of Hepatology. Today's session is Liver Disease and Ramadan, and our expert for tonight is Dr. Zeeshan Ali Junejo. Before I introduce our expert for tonight's session, we have to go through some standard announcements. We are part of a global movement called Project ECHO based in USA with an objective to disseminate knowledge and best practices. We do protect patient privacy, so none of the information used in the session will identify any individual or patient. For maintaining discipline, you all are muted, but we do encourage participation. So you can unmute yourself for questions and use the raise hand option or chat box. By participating, you have given the consent for recording. The recorded session will be available on our YouTube channel. Link will be shared by Uzair in the chat box. For CME credits, please contact Uzair, our coordinator. His number is mentioned on the banner. CME credits are affiliated with Jinnah Sindh Medical University. Uzair will share the Google form at the end of the session. I think he already shared it, which will be active for 12 hours. You are requested to fill it as soon as possible to avail the opportunity of CMEs. For the convenience of spoke, the session is bilingual. Please speak in Urdu or English, whatever language you are comfortable in. Our expert for tonight's session is Dr. Zeeshan Ali Junejo, is a fellow of College of Physician and Surgeon Pakistan and currently working as Associate Professor of Medicine at Jinnah Sindh Medical University and Jinnah Postgraduate Medical Center, Karachi, Pakistan. He has been involved with Parsa Eco Pakistan since the very beginning and been a true eco champion. Sorry. He's the eco lead in the province of Sindh and has a keen interest in medical education. Currently, he also holds a portfolio of Vice President, Pakistan Society of Hepatology. He is responsible for overseeing all projects related to Sindh and enrollment of spokes locally. So I would hand over to Dr. Zeeshan now.
Thank you for the kind introduction, Kiran. I hope you can all listen me well, and let me share the screen before I start with.
Zeeshan, we can hear you and we can see your slides. Looking towards some exciting knowledge. I'm very sad आपका जो आज की टॉक है वो एक अजीबोगरीब से एक्शन थ्रिलर में फंस गई है, लेकिन anyhow we are all here.
So, yes, we may hear news anytime. I know the political situation going on in the country, and in fact everybody is glued to the news channels right now, thanks to the people who have given time to the academic activity. So I'll be starting with today's talk, and as the Ramadan is just around the corner and it is right time to talk about Ramadan and the liver disease. As you all know, Ramadan is the 9th. Before I proceed, I must acknowledge that these slides were made by Professor Javed Iqbal Farooqi, and I'm sharing his slides, though I have updated few of them, but most of the slides are actually made by Professor Javed Iqbal Farooqi. So the Ramadan is the lunar-based Islamic calendar 9th month, and as you all know, the lunar calendar is 10 to 11 days shorter than the Georgian calendar. So the whole Islamic calendar actually revolves in all seasons. And as you know, in Pakistan, this time it's summer. And today the temperature in Karachi was 42. And it was around 12 hours of 12 hours and 20 minutes of total from dawn to dusk time. So that's what we are expecting, more than 12 hours fasting in Pakistan. Some part of the places in the world, it may be 18 or 20 hours, and at times 22 hours even at the extremes of the North Pole. So what changes in the Ramadan is during whole fasting period, we are not eating or drinking anything by mouth. And for that, and when we open the fast at iftar time, the diet which we take is usually different from what diet we are taking normally. And as a tradition in Pakistan, it's more oily, it's more salty, and it's more spicy as well. And a lot of carbohydrates are taken many of the time. So the calorie content and the quality of the food is much different from what we are taking usually in our daily life. So based on that, many of the time when we are practicing, patient come to us and ask that should we fast, or having a liver disease, they may have questions related to any harm related to their fasting, or at times they are pushing us to allow them to fast when they are not fit enough or they may not tolerate it. So when we are asked about these questions, we must be very professional in our advice that being as a Muslim, we should not advise something which is not based on Islamic teaching, and which it should be evidence based and scientific as well, should be logical and clear so that it should not contain any ambiguity. So talking about the Islamic background, being as Muslim, it's always good to know the references of the Quran and quote it to the patient when we talk about, because many of the time they don't have correct beliefs and correct knowledge of what the Quran says. It is a one of the very important pillars of Islam. Yes, in Surah Baqarah, ayat number 183, it clearly says that it is decreed upon you fasting as it was decreed upon those before you. So that's what the Allah says, that every Muslim have to fast. But at the same time, there are some exceptions, and these are exceptions or are not from our side, but it is in the Quran, and it is with the reference very next ayah, in which there is Allah asking us to fast. It has Allah has given some exceptions. فَمَنْ كَانَ مِنْكُمْ مَرِيضًا, those who are ill, they are given exceptions, and the illness may be time bound or illness may be long lasting. If the illness is time bound, then Allah says that you may, who are able to fast later, can count the days which they have left actually, or they can feed the person if the illness was prolonged enough that they could not count those days in other days. Definitely, those who can fast, fasting is better for them. That's what Allah says in ayat number 184 of Surah Baqarah. But in next ayat, that is 185, it further says, whosoever is ill or in journey is exempted from this obligation of Ramadan. So this is, I have kept very important. We are all doctors here, but we should be knowing exact references of the Quran so that we can convince our patients. When diabetic patients or chronic disease patients come to us, many of the time they say, no, we cannot leave it. It is very important. You should give them with the clear references that they can omit the fast if they are not fit enough to it. So these are the exceptions in the Quran for the prepubertal children, for the women, for the menstrual period, for pregnant and the breastfeeding women, elderly who cannot tolerate the fasting and risk of hypoglycemia, mentally disabled, traveling, prolonged traveling, and the sick people who are not well or cannot tolerate prolonged fasting. So these are all exceptions we all should know, and we should, when we or based on scientific evidence see that this fasting may harm them, then we can very confidently ask them not to fast. So when it comes to the decision making about any patient's advice, we have got clinical data and then we get some laboratory data. For the clinical data, any patient who is in active jaundice should not be allowed to, those who have encephalopathy, the recent GI bleed, or those with ascites and hepatocellular carcinoma. These are clear clinical indications in which these patients are not fit enough to fast, and we should straight away ask them to omit the fasting. Other patients are very malnourished. Sarcopenia is one of the common problem in cirrhotic patients. Those who are already in sarcopenic are a high risk of hypoglycemia, and those with multiple comorbids along with the liver disease are a very high risk of hypoglycemia and other complications such as dehydration for the fasting. So they may very easily be asked not to. If in doubt, we can check LFTs and the biochemistry of the patients with electrolyte, blood urea creatinine. In those patients, we are in doubt whether or not they are going to tolerate with the fasting or not. So having said that, the clinical decision making, then comes those with elevated ALT, those unable to tolerate, or those may or may not to be tolerate. So those who have got T range LFTs and biochemistry should clearly be stated not to fast. Those who are critically ill or debilitated, starved or malnourished should not be, who may not able to tolerate should ask not to fast. And those who may or may not be observed and biochemistry may be checked and tests will be checked and evaluated whether or not it would be safer for them to fast in this season. So we will be talking about a healthy liver, patients with acute hepatitis, chronic hepatitis, cirrhosis with any cause, or liver transplant patient. This is the spectrum which I will be talking about, and we'll be discussing individually all these. In acute hepatitis, we'll cover the same will be covered with the acute liver failure. In chronic hepatitis, fatty liver, chronic hepatitis B and C, and cirrhosis, will grade them as CTP A, B, C. In chronic hepatitis and cirrhosis, we will cover the hepatocellular carcinoma as well when it comes. So healthy liver, should it these patients be fasting? It is particularly important in Ramzan. This time is would be hot and it would be dry summers, and these would be more than 12 hours days. So what physiological changes takes place while fasting? Number one, we are starving, we are not eating or drinking anything, and then we are, because of this temperature, we are dehydrated. There is because we are not drinking anything, and there is change in dietary habit and acid production. Whatever we eat at iftar is too much acid stimulant, and it increases acidity. Risk of GI bleed increases in vulnerable people. And then there is changes because of dehydration and starvation. There is changes in the platelet aggregation. Then in some inflammatory markers are changed. So there may be some changes with the platelet function as well. So what would be the impact? Ramzan fasting result in significant improvement in BMI. Many of the patients studies suggest that people lose some weight, although we are not reducing the caloric intake most of the time, but still the intermittent fasting or Ramzan fasting have led to this belief that because of the prolonged fast, there is some biochemical changes in the body which promote weight loss and improves BMI and blood lipid profiles and oxidative stress criteria. So it is now evidence-based that the fasting is beneficial to human body. Whether it is Ramzan fasting or otherwise intermittent fasting nowadays have taken place in Karachi. A lot of talk is around the corner, and non-medical fields that they are doing intermittent fasting, and it promotes weight loss. Then improvement in the levels of adipokines and histology of hepatic steatosis have improved. And there are clear evidence and data available in which liver steatosis have improved. Again, intermittent fasting is also one of the methods for the treatment of fatty liver and hepatic steatosis. Changes in vapsin and omectin, these are the two novel adipokines which affects the insulin sensitivity as well as inflammatory markers and the hepatocyte ballooning in the liver. Then there are other inflammatory markers which improve favorably in the liver health and overall human health, which because of the fasting. So I will be sharing one of the study in which 57 healthy people, including 35 males and 32 females, were aged between 15 to 24 were recruited, and liver function tests including bilirubin, ALT, AST, alkaline phosphoalbumin were measured before Ramzan, during the Ramzan, and a month after the Ramzan. What the data suggests in these people that the bilirubin at second week of Ramzan it was unchanged, but at fourth week it actually increased, and on 1 month after the Ramzan there was some increase in bilirubin. So again, ALT significantly reduced, but at 4 weeks it was unchanged, and after the Ramadan it remained unchanged. AST again increased, with after 4 weeks again it increased and increased further after 1 month after the Ramadan. Alkaline phosphate again this was unchanged, remained unchanged. Albumin remained unchanged during the Ramadan, but increased after the Ramadan. So these are the biochemical changes, how it affects the liver. We would check about the liver diseases, but these were the healthy adults which were taken, and these biochemical changes. One of the question is Gilbert syndrome, in which the liver biochemistry is otherwise normal, bilirubin is increased. These patients can safely fast. Fasting generally increases the bilirubin level in Gilbert syndrome, but it does not have any deleterious effect on the. So these patients can very safely be fasting. So healthy liver can definitely fast. This green color, uh, which we have changed, that these are the people who can clearly fast. Now come the acute hepatitis and acute liver failure. Typically, the course of acute hepatitis may extend over the several weeks, and the malaise, anorexia, nausea, vomiting, and jaundice and elevated liver enzyme may remain for 2 to 4 weeks. These patients clearly are not the candidate of the fasting. They need supportive treatment. They cannot be dehydrated. They cannot be calorie depleted. They cannot tolerate prolonged fasting, and we know, and they are unlikely the new studies are going to come to test this. This is a clear no-go area for any patient who comes to you and asks for the whether or not we are going to we should be fasting or not. These patients may require hospitalization, and they need frequent small meals, and they should not be allowed to fast. It should be forbidden fasting. Strongly against fasting for acute hepatitis, and so is true for acute liver failure. That's a life-threatening condition, and liver goes into failure, a compromised status. We should be very clear about them, and we should be advising against them. So there is clear red mark for the acute liver failure and acute hepatitis. These people should always be asked not to fast, because it would be harmful. It could potentially harmful for them. Coming to chronic hepatitis, I will first discuss the fatty liver. I've talked about some of the physiological changes taking place in the liver during the fasting, and they are all helpful. The adipokines, the inflammatory markers, which are changing in favor of reducing hepatic steatosis, and intermittent fasting itself has established its role in treatment of NAFLD and weight loss. So these are all beneficial effects which are taking place in patients who are fasting. So definitely NAFLD remains an area in which the fasting is beneficial to these patient and the disease. So these patient, how I would give correlate with the evidence. This is one of the study in which 50 NAFLD patients, including 33 males and 17 females, aged 18 to 65 years, were recruited. Fasting serum levels of the LFTs, including lipid profile, fasting blood sugar, ALT, liver enzymes, but 7 days before the Ramadan, 2 days of the Ramadan, and 27 days of the Ramadan, and 6 days after the Ramadan. Findings on daily. And what they found was the systolic blood pressure significantly reduced. That was statistically significant. And then in females as well, though it remained same. Total caloric intake was reduced in these cases. Again, that was not statistically significant here. What again further what they saw the HDL significantly improved, and that was important, and that was beneficial. And FBS, though it increased in male and female, but it wasn't it may not have been the p-values were significant, but what health effect they had, because did not affect anything. So NAFLD patient can safely fast, and Ramadan fasting has significant impact on NAFLD and decreasing the ALT, AST, systolic blood pressure, diastolic blood pressure, and increasing the LDLC. And the inflammatory markers that I talked about that improves the liver steatosis, reduces the liver inflammation, and overall beneficial effect on the weight loss. So these patients can definitely fast. Coming to chronic hepatitis B and C, and again, one of the study in transgenic mice animal study, in which HBe antigen level increased to 48%, 48 hours, and tenfold increase in viral replication. However, it was not confirmed in human studies. In HCV, there was clear evidence that their viral replication increases, but there was no evidence that this increase in the viral replication have got any deleterious effect or any effect on the enzyme levels, ALT and AST, or any inflammation or fibrosis. So this was a study with 202 patients, in which 103 was the fasting group, and non-fasting group were 99. That was randomized trial which took place in chronic hepatitis group, and they show no significant changes in pre, during, and post Ramadan regarding liver function and liver biochemistry. So these patients again can safely be fasting, but some patients, because we know that viral replication increases, these patients, if they have symptoms or they are at high risk, may be monitored for their viral DNA or RNA in case of hepatitis B or C. If the patients are taking soft-based therapy for hepatitis C, again, they can fast, but they have to ensure that they should not get dehydrated, because the soft may have effect on the renal function if the patient is dehydrated. So that has to be taken into account. Otherwise, these patients can very safely be fasting. But they have got some caveats. We should be looking after and monitoring these patients. Coming to liver cirrhosis, we'll look into CTP A, B, and C. Again, CTP A patients are compensated cirrhotics, and they do not generally have any liver dysfunction, but just the liver is stiff. These patients can, again, as the patients with the chronic hepatitis, fast regardless of the etiology. If they are in CTPA, they don't have any evidence of decompensation. But CTP B and C are those patients who are decompensated and being monitored very closely. So the compensated cirrhotics generally don't have varices, or they have non-bendable varices. These patients may have hepatocellular carcinoma, acute and chronic, or recurrent hypoglycemia. If any of the stage of these patients having these risk factors, they may not be fasting. Similarly, those patients with cirrhosis who are having diabetes as well are very prone to have hypoglycemia, and we will be very careful in these patients, allowing them to fast. Even if their diabetes is well controlled, and for the diabetes context, they may be able to fast. But if they are cirrhotic, we have to be very careful while looking into these patients, because they have got risks of hypoglycemia, and that may be potentially life-threatening to them. If the patient develops acute liver failure, acute or chronic liver failure during the Ramadan, they should all clearly be advised, if they were fasting, not to fast further. And hepatocellular carcinoma is a big no area, and these patients have got limited life expectancy. They may not be allowed to fast. But those patients who are decompensated, again, in CTPC, where there is ascites or HRS or SBP or hepatic encephalopathy, they are clear at high risk of hypoglycemia and dehydration. Hepatic encephalopathy, they should be very clearly asked not to fast. There is a question and there is a confusion for the CTP-B, but most of the experts believe that these patients again should be observed and may not be allowed. If they are very stable, yes, they may be with very close monitoring, very frequent follow-ups, they may be, but most of the experts believe the data is not in favor or allowing them to fast. So the complications which they may come across is portal hypertension or impaired liver function or liver hepatic failure when it comes to decompensated cirrhotics. And most cirrhotic patients have got poor appetite, they have early satiety, and they have poor absorption or liver sarcopenia, liver-related sarcopenia. Their glycogen stores are very poor. Liver is not maintaining blood sugars. They are very high risk of hypoglycemia because their gluconeogenesis is not taking place, and their muscle mass is not there to support gluconeogenesis as well. So in CTPA, 25% of the patient may be malnourished, but in CTPC, 80% of the patients are sarcopenic. So that's where this is the knowledge you should be carrying with them in your clinic, and while assessing your patient whether these patients can fast or not. Challenges are the compliance with the medication may be an issue in these patients because of the behavioral changes. Again, with more than 12 hours gap of dawn to dusk for a seher to iftar, some medications compliance may be affected, and that may not be favorably helping these patients. Postprandial hyperglycemia, again, which happens in most of the patients as the liver is not able to handle the glucose load, and there is insulin resistance, liver related insulin resistance in most of the cirrhotic patients as well. Portal pressure increases because of the prandial intake. The seher and iftar, we take large meals, and that increases blood flow, and that can lead to the variceal bleeding as well. So patients many of the time are on diuretic therapy or in decompensated, they may not tolerate dehydration, and they may end up with acute kidney injury and the hepatic encephalopathy if they are fasting. So these are the challenges, and we have to be looking into our patients. So the risk is protein malnutrition, deterioration of liver function, development of hepatic encephalopathy, or GI bleed. Therefore, action plan must be individualized to enable patients, those who can fast without adverse. Patient must be monitored closely by their physician while fasting, particularly because in CTP A and B, where if you have allowed them to fast, if any signs and symptoms of liver deterioration occur, fasting may be permanently discontinued in these patients. There are some studies. I'll share, the skim through these studies because again, I may not have much time here to discuss in details. Elantre in 2011 published this data with 202 patients fasting, 103 I've just referred previously as well. What the findings were, the dyspeptic symptoms were higher. GI bleeding during the Ramadan was higher in fasting group compared to the non-fasting group. In varicose bleeding was significantly higher in non-fasting group. Again, it wasn't higher but ulcer bleed was much higher in fasting group, and varicose bleed was much higher in non-fasting group in these patients. That was the finding of this. And chronic hepatitis fasting group showed no significant change during the post-Ramadan regarding liver functions. Again, that's where we recommend that chronic hepatitis patient, otherwise, if they are not decompensated, can clearly fast. Cirrhotic patients, the frequency of deterioration child C was very high. So this was one of the clear evidence that patients with child C should not be fasting. They are very high risk of complications of the cirrhosis. Again, one of the study which was published in 2011, here it was also observational with cirrhotic patients only. 27 patients discontinued in this patient, could not fast, tolerate the fasting. Varicose bleeding and encephalopathy reported in 8 and 6 patients in this patient. And Ramadan fasting had no significant impact on portal flow. In this particular study, the portal flow was again, we have seen in cirrhotic patients, portal esophageal varicose bleed was not common during the fasting, but other complications were more common. Male gender, CTP class A, and absence of GI bleed were independent factors in reduction in liver enzyme and serum glucose and tolerance to the Ramadan fasting. Older age, diabetes, and child class C was independent factor, elevated serum bilirubin and creatinine during the Ramadan fasting. Again, this was the evidence that child C cirrhosis may not tolerate fasting in these patients. Another Egyptian study, which again with 40 patients only, but the cirrhotic patients had significantly short-term change in the portal blood flow, and the congestion index was increased, and though there wasn't any increase in bleeding of these subjects. 7 patients developed complications, 2 cases have got varicose here. As a result, deterioration reported in child C. So the evidence is very clear for child C, though it is not very clear for child B. For again child A, it is found to be safe and there was no change in the weather. This was a study that suggested in child A there wasn't any change. So these patients with child A can clearly fast safely with monitoring. Child C should never be fasting. Child B remains the area where the expert opinion generally favors not to allow them fast unless they have got very stable liver functions for a prolonged period. This again is a summary of all these 3 studies. I will just skim through. Again, this was one of the review published in 2021 January, and it was a cartoonic presentation. Child A can fast, child B should not fast, and child C should never fast. That's what the bottom line is. And for even child A, there was risk of GI bleeding, ulcer, GI bleed, so they should be on PPI. If they are having varices, they should be banded before the Ramadan, and nutritional advice to ensure good calories, and the weekly follow-up may be required in some patients. And if there are any deterioration, they may be discontinued fasting. Patients with HCC, again, these patients have got limited life expectancy. Advanced HCC have got frequent hypoglycemias. Otherwise, unprovoked hypoglycemia can take place, and these patients can end up with significant complications and should not be allowed to the fasting. So coming back to the same, close monitoring, may fast, refrain from, B should refrain, and C should always be asked. HCC decompensation, don't find compensated liver cirrhosis on sorafenib. Again, with stable liver functions, you may opt for these patients, but liver reserves has to be there if these patients are willing to fast. Coming back to our scheme, healthy acute liver failure, here CTP B and C, the overall expert advice is not to allow them to fast. Coming to the liver transplant patient, again, liver transplant is an era we are seeing patients with the post liver transplant, and in general, what I would share a study here. It was an extensive study in which they looked at most of the markers which were unchanged and there's no significant difference between these biochemistry of these patients. But what they concluded in first 2 years of the transplant, when immunosuppression is very high, it is generally recommended not to allow them to fast. And after the 2 years with the stable liver functions, post-transplant patients can easily be fasting. There may not be any issues if the liver functions are good and stable. With that, probably I would just stop there and ask questions if you have any.
Thank you. Thank you very much, Zeeshan. I think you did phenomenally well. बहुत सारी कॉमन चीजें हैं, कॉमनली आस्क्ड क्वेश्चन है, और रमजान इज अराउंड द कॉर्नर. I can see Professor Altaf Alam here, some other experts, Daud has joined. मैं सिर्फ ज़ीशान आपसे ये सवाल करना चाहूँगा, हम सब कुछ कर लेंगे, आप काउंसलिंग कैसे करते हैं, जरा मुझे इसके बारे में भी बताएं. चाइल्ड बी और चाइल्ड सी की मिसाल ले लें, आप काउंसलिंग कैसे करते हैं?
सर, मैंने आपको जो पहली 3 स्लाइडें अपनी दिखाई थी ना, एंड दैट आई यूज कि भाई आप मुसलमान हैं तो कुरान को फॉलो कर लें जो कुरान में लिखा हुआ है. एंड आई हैव लिटरली, मैंने शायद बहुत सारी आयत के तर्जुमे या नहीं पता होंगे, लेकिन ये सूरह बकरा की 3 आयत के तर्जुमे बहुत फ्रीक्वेंटली मैं पेशेंट को कोट करता हूँ. एंड बिकॉज दोज हु पुश अस के जी हमें रोजा रखना है, आर दोज हु आर एक्चुअली डूइंग इट फॉर देयर रिलीजियस बिलीफ ना. एंड इफ यू गिव देम विद कुरानिक रेफरेंस, and that was the sole purpose I kept that in this presentation, you must be knowing it and you have to convince them that it is not Allah asking us to harm our body, it's we ourselves trying to harm. So if their body is not accepting it, they should accept this fact.
I saw Nadeem Tehami here. Nadeem, are you with us?
Ji, Assalamu alaikum.
Wa alaikum salam. A very warm welcome, Nadeem. Good to see you.
I'm sorry I joined late. Like, I think it was a fascinating talk as ever. Or I learned more. Thank you so much.
So, आप कैसे counsel करते हैं? आप, you know, and what are the problems you face in UK, especially with regards to liver disease and Ramadan?
देखिए, as a physician हमारी responsibility और एज ए मुसलमान हमारी रिस्पॉन्सिबिलिटी होती है कि जो सच्चा साफ मैसेज है वो लोगों तक पहुंचा दिया जाए. एंड आई थिंक रेस्ट इज जो पेशेंट हैं वो उनकी अपनी ईमा पे होता है कि हाउ एवर दे विश टू प्रोसीड. तो आई डोंट टेंड टू फोर्स एनीवन. ऑब्वियसली माय रिस्पॉन्सिबिलिटी इज टू जस्ट कन्वे द मैसेज एज आई अंडरस्टैंड इट. क्लियरली माय अंडरस्टैंडिंग इज लिमिटेड. आई एम अ ह्यूमन बीइंग, सो all I can do is just provide the evidence available. There's a very nice practical advice and recommendation paper shared, I think published 2 years ago by Egyptian group, which I shared this morning on a Twitter. And I think it was similar to the recommendations as Zeeshan shared in his presentation. And I think his message was quite clear.
It was Nadeem, it was actually based on the same paper, Egyptian paper. That is an excellent review and very clear evidence and suggestion there.
जी बिल्कुल, और बहुत शुक्रिया और congratulations on such a fascinating talk.
Thank you. Any other questions meanwhile from the audience on this burning issue? You have option of raise hand. आप chat में भी सवाल कर सकते हैं. और ज़ीशान, आपने बहुत अच्छा पढ़ाया है मेरे ख्याल में.
इसके 2 ही मतलब होते हैं ना, या तो आप बहुत अच्छा पढ़ा गए, बिल्कुल ऐसी बात कर गए जो किसी को. We have got a raise hand finally.
मेरा ख्याल है हम सब के जो उस्ताद हैं, प्रोफेसर अल्ताफ आलम, उन्होंने I think he has coached us in a really simple and in a way that we have developed a habit of delivering a very clear and crisp I think
Yes,
Zeeshan is
एक raised hand जी फारूक, please go ahead.
जी अस्सलाम वालेकुम सर मेरा क्वेश्चन ये था कि हेपेटाइटिस सी से रिलेटेड बहुत ज़्यादा पेशेंट्स में चाहे स्पॉन्टेनियस वायरल क्लियरेंस हो जाए, नॉन सिरोटिक हो, और चाहे DAS एक्सपीरियंस पेशेंट हो, उसके अंदर अक्सर डिस्पेप्सिया वाले सिम्टम्स और फंक्शनल डिस्पेप्सिया वाले सिम्टम्स काफ़ी देर तक आते रहते हैं और वो पेशेंट को डिस्टर्ब भी करते रहते हैं फॉर ईयर्स एंड ईयर्स। तो इसके साथ जो एसोसिएटेड GI सिम्टम्स हैं, उस वो पेशेंट जो कभी वॉमिटिंग कर दी, तो कभी डिस्पेप्सिया हो गया, तो कभी इरिटेबल बाउल हो गया, उनके लिए क्या रिकमेंडेशन होगी फॉर फास्टिंग?
अच्छा, एक्सीलेंट क्वेश्चन फारूक। इसमें एक तो बात यह है कि मेनी ऑफ द टाइम जो उनकी हेप सी डायग्नोज होती है, दीज आर बेस्ड ऑन दीज डिस्पेप्टिक सिम्टम्स, और उनको फंक्शनल डिस्पेप्सिया या IBS लाइक ही होते हैं व्हेन दे एंड अप विद अ गैस्ट्रोएंटरोलॉजिस्ट। most of them screen them for the hepatitis and they are found hepatitis C may or may not be the cause of those symptoms, and when they are treated they may continue to have dyspeptic symptoms after that. Cirrhotic patients के अंदर मैंने डेटा कुछ शेयर किया था कि पेप्टिक अल्सर ब्लीड बिकॉज ऑफ के एसिड सिक्रीशंस जो है वो बढ़ जाती हैं, तो पेप्टिक अल्सर ब्लीड की इंसिडेंस ज्यादा देखी गई है। इस वजह से रिकमेंडेशन है कि जो सिरोटिक पेशेंट्स जब अगर फास्ट करते हैं तो यू शुड इंश्योर दैट दे आर ऑन PPI ड्यूरिंग द रमजान। कमिंग बैक टू पेशेंट्स विद IBS और ये फंक्शनल डिस्पेप्सिया, जो अच्छे भले लोग होते हैं जिस किस्म के हम खाने खाते हैं इफ्तारी के अंदर, वो अच्छे भले मैदे वाले पेशेंट्स को भी जो है ना IBS और फंक्शनल डिस्पेप्सिया अच्छा खासा करा सकते हैं। सो दोज पेशेंट्स की जो डाइटरी एडवाइस है दैट शुड बी कि बहुत ज़्यादा वो ज़्यादा इंपॉर्टेंट है कि बहुत ज़्यादा जो हम कार्ब्स लेते हैं, बहुत ज़्यादा फैट लेते हैं, बहुत ज़्यादा स्पाइसेस लेते हैं, दैट हैज़ टू बी बैलेंस्ड। और अगेन FODMAP इज द बेस्ट वे टू डाइटरी एडवाइस। अब ऑन टॉप ऑफ दैट सिम्टोमेटिक जो ट्रीटमेंट हम रूटीन में इन पेशेंट्स को देते हैं वो ऑगमेंट करनी होती है आपको। अगेन विद द 2 times सहर एंड इफ्तार टाइमिंग्स, मोस्ट ऑफ द मेडिकेशंस वुड एंड अप इन इफ्तार। काफ़ी दफ़ा मैं पेशेंट्स को यही कहता हूँ कि आप इफ्तारी के अंदर पानी के साथ दवाएं ले लें जो एम्प्टी स्टमक होती हैं, देन गिव 10-15 मिनट्स ब्रेक कि नमाज वगैरह पढ़ने के बाद दे टेक देयर मील्स, और दे ट्राई एंड आई कीप ऑन एडवाइजिंग कि एक नॉर्मल मील लें रादर देन बहुत एक्सेसिव जिसे कहते हैं फैट और spicy meal or most of the time patients do tolerate. In that case I would like to take comments from Professor Altaf, senior है हमारे, ख्याल बेहतर एडवाइस कुछ और बता सकें तो।
I can see Kamran Shafiq, he has experience of both East and West. So Kamran, if you can unmute yourself and give your comments, please. Kamran.
Thank you, Professor Altaf. Thank you for your kind words. Bilkul, I can say I have experience for both sides. Or I think Zeeshan, first of all, I'd like to congratulate Zeeshan. Very fantastic talk. Or बहुत, I think practically, to be honest, was good studies. हम यही होता है कि child PUA या जो patient stable है उसमें तो यही है कि we don't, और नेफल में जैसे हमने डेटा प्रेजेंट किया वही प्रैक्टिस है, लेकिन वाकई B और C का बड़ा अच्छा आपने बताया माशाल्लाह, और आई थिंक मेरी प्रैक्टिस भी यही है। बाकी जो डिस्पेप्सिया के सिम्टम्स, सॉरी जो मैं उस पर आता हूँ, वो ये कि क्योंकि एज ए आई पर्सनली फील कि ऑलवेज देयर इज अ कॉज फॉर द सिम्टम। आई नो वी हैव IBS फंक्शनल डिस्पेप्सिया, मैं एक्चुअली चाहता हूँ कि पेशेंट का H. pylori स्टेटस चेक हो कि उसको किया है कि नहीं, मैल अब्जॉर्प्शन नहीं है, IBD नहीं है, बिकॉज वी ऑल नो कि इट कैन टेक मैनी ईयर्स टू एक्चुअली फुल ब्लोन IBD, वहाँ पे भी 1.5-2 साल लग जाते हैं डायग्नोज होने में, इवन वेस्ट में। तो आई थिंक प्रैक्टिस वाइज, आई थिंक जैसे नदीम ने कहा माशाल्लाह कि वी कैन एक्चुअली गाइड, और टू बी ऑनेस्ट मुझे चैलेंजिंग बिहेवियर टू बी ऑनेस्ट ना ईस्ट में और ना ही वेस्ट में मिला है कि जहाँ पेशेंट ने इंसिस्ट किया है कि जी मैंने रोज़ा रखना ही रखना है, आप जो मर्जी मुझे कह लें, चाहे मैं आपका चाइल्ड PUB है चाहे एडवांस है, उन्होंने आपसे ये पूछा है कि सर मैं रोज़ा रख सकता हूँ कि नहीं। तो ये पाकिस्तान में जैसे आपको पूछा जाता है क्लिनिक्स में, तो आई थिंक वंस यू गाइड देम, और आई विश कि मुझे भी ये आयात आती हूँ जो ज़ीशान माशाल्लाह उनको बताते हैं। तो आई पर्सनली थिंक के ये यही है जो हम वहाँ पे भी जो मुसलमान आते हैं हमारे पास, आई थिंक दे आर गाइडेड एज नदीम सेड, and they don't have not I have not find any challenging behavior where I being challenged.
Thank you Kamran, welcome, good to hear from you. और अब मैंने आपको जाना नहीं देना, बट थोड़ा सा आइडेंटिफाई हो गए तो आपको आई थिंक we're gonna get you on board very soon.
Always will join you inshallah.
Thank you very much. Any other question or comment? We still have time.
अस्सलाम वालेकुम सर।
जी भुट्टा साहब प्लीज गो अहेड।
जी सर, बड़ी अच्छी प्रेजेंटेशन दी डॉक्टर साहब ने, और डॉक्टर त्यामी साहब के बड़े अच्छे कमेंट्स थे। मैं भी यही पसंद करता हूँ कि जैसे उन्होंने कहा कि पेशेंट को एक्सप्लेन सारी सिचुएशन कर देनी चाहिए और फिर उस पर छोड़ देना चाहिए कि वो क्या डिसाइड करता है, क्योंकि टॉलरेट करेगा तो रख लेगा, नहीं टॉलरेट करेगा तो नहीं रखेगा। किसी को फोर्सिबली मेरा ख्याल है इतना नहीं करना चाहिए, सिर्फ एक्सप्लेन करना चाहिए। मेरा तो ज़ाती तजर्बा और मेरा एक्सपीरियंस तो यही कहता है। थैंक यू वेरी मच।
अच्छा जीशान, अल्ताफ साहब भी इधर हैं, बाकी लोग भी। एनी स्पेशल प्रेफरेंस फॉर एंटीवायरल थेरापी टाइमिंग with seher or with iftar? Any comment on this?
I generally prefer iftar, and क्योंकि वो empty stomach होते हैं उस टाइम पे, and जिसा मैंने कहा कि part of my practice is diabetes as well, where empty stomach, उसमें एडवाइस यही होती है कि आप इफ्तारी के अंदर पानी के साथ आप दवा ले लें और दिन नमाज के बाद जो है that will give 15-20 minutes to them. That's where, because क्योंकि इफ्तारी में और फिर सहरी में हम अक्सर काफ़ी टाइम खाते हैं कि आपने जिस तरह पाकिस्तान के टाइमिंग्स हैं, इफ्तारी के 6-7 बजे आपने खाया, फिर आपने ईशा के टाइम पे खाया, फिर आप रात 3 बजे फिर खा रहे हैं। So most of the time your stomach remains full and there may be some जैसे कहते हैं absorption issues, क्योंकि इनिशियल जो गाइडलाइंस आई थी सॉफ्ट के लिए वो एम्प्टी स्टमक ही आई थी, दो people are using after the meals as well. But again PPI जो challenge है, that is the patient है और GI bleed और फिर सॉफ्ट के साथ PPI का जो इंटरेक्शन है, that has to be balanced. कि अगर आप सॉफ्ट वाले पेशेंट्स पे हैं, we ensure that, क्योंकि many patients which are not liver disease patients are taking PPI during the Ramadan. So this is very important thing which we should be looking after कि भाई वो PPI ना ले रहे हो, because that significantly reduces the efficacy of the soft, and then we see non-responders in the relapses.
Dr. Altaf, do you have anything to add here?
No, I totally agree. Generally speaking, when you are using DAs, तो high dose PPI avoid करनी चाहिए, because there is definite evidence that twice daily or more certainly reduces efficacy, and one should restrict to once daily if there is dire need for the patient. बाकी बिल्कुल ठीक बताया कि पेशेंट करेगा वही जो उसका दिल करेगा, फॉलो अप भी नहीं कराएगा और कॉम्प्लिकेशंस के साथ आ जाएगा। लेकिन आपकी ना सिर्फ मेरी गुजारिश ये है कि ना सिर्फ उसको काउंसल करें, बल्कि एक ब्रीफ सेंटेंस लिख भी दें उसकी नोट्स में, ताकि ये हमेशा के लिए डॉक्यूमेंट हो जाए, एंड विच आई ऑलवेज डू, के एडवाइज्ड अगेंस्ट फास्टिंग, सिंपल एज दैट, ताकि कल को ये होता है कि आपने तो बताया ही नहीं था, आपने तो गाइड ही नहीं किया था, एटसेट्रा। चाहे आपने 10 मिनट लगाए हो इस बात पे, लेकिन पीपल हैव द हैबिट ऑफ सेइंग दैट, सो वन हैज टू बी वेरी क्लियर। और ये जो गाइडलाइंस दी हैं ये बिल्कुल ठीक है। एक्यूट हेपेटाइटिस नो, चाइल्ड क्लास BC नो, HCC नो, और ये बड़ी क्लियर गाइडलाइंस हैं कि इनमें आप ना दें। अभी एक रीसेंट स्टडी जो इसी महीने पब्लिश हुई है नेफल्ड पे, और उसमें उन्होंने कैप और लिवर स्टिफनेस भी देखी है, और उनकी जो ये इजिप्ट से अगेन पब्लिश हुई है और इसी मार्च इजिप्शियन लिवर जर्नल में, और उसमें यही उन्होंने बताया कि नेफल्ड में इट हैज अ बेनिफिशियल इफेक्ट not only on metabolic parameters, liver enzymes, but also in terms of CAP and liver stiffness. So certainly in NAFLD patient, intermittent fasting during Ramadan or otherwise is beneficial. There is sufficient evidence for that, and we should encourage that otherwise as well. Of course, all these patients need to lose weight. There are no approved medicines, so if it is helpful, certainly it should be emphasized to, particularly to NAFLD patient, of which we have plenty around us. So, clear advice and a brief documentation on the notes will help and go a long way to not only emphasize what you are saying, but also to protect you if you run into any problems with that particular patient. So that's it. Whatever I had to say. We have a raised hand, Mohammad Farooq. Farooq, you want to say something?
जी सर, मेरा क्वेश्चन ये है कि फास्टिंग से पोर्टल हाइपरटेंशन वर्सन होती है या नहीं?
ज़ीशान,
अच्छा, फास्टिंग में जो है ना पोर्टल फ्लो डायनामिक्स चेंज होते हैं, बट इट इज मोर ऑफ द फेड स्टेट कि जो फ्रीक्वेंट हाई कैलोरिक मील्स हम लेते हैं ना ड्यूरिंग द फास्टिंग, इसी वजह से जो डायनामिक्स है, बट इसका इफेक्ट जो है ब्लीडिंग के ऊपर जो है वो नहीं देखा गया है। जो स्टडीज हुई हैं वेरेसल ब्लीड के ऊपर जो है, मोस्ट ऑफ द स्टडीज हैव शोन द फास्टिंग ग्रुप्स जो कंपेयर किया गया नॉन फास्टिंग ग्रुप्स के साथ, तो वेरेसल ब्लीड वाज फाउंड टू बी लोअर, दो द कंजेशन इंडेक्स जो कि लिवर का जो है पोर्टल प्रेशर है और सप्लाई है, that has clearly been found increased, but it has not translated into the increased risk of bleeding in most of the cirrhotic patients.
एक और जो ऑब्जर्वेशन है, मे बी माय पर्सनल या एनेक्डोटल मैं बात करूंगा कि दो किस्म के पेशेंट हैं जिनमें मैंने ये देखा है। एक तो वो लोग हैं जो who go against the advice, child B होंगे, and they will fast, whom we are unable to convince, and the other one वो लोग जो हज उम्रे पे चले जाते हैं against advice in a similar category। और अब रमजान में आपको पता है ये भी एक फैक्टर है कि आप उम्रा खुल भी गया है तो बहुत सारे लोग अब आ रहे हैं जो दे आर गोइंग टू सऊदी अरेबिया, क्योंकि वो एक फुल फ्लो है वहां पे। माय ऑब्जर्वेशन इज के वो जो डीकम्पनसेशन है सो कॉल्ड, इट हैपेंस अ फ्यू वीक्स लेटर। इट्स नॉट दैट ड्यूरिंग वो सारे रोजे भी रख लेते हैं और आके आपको एक बार सुनाते हैं जरूर है जी आपने मुझे डरा दिया था, ये देखें मैं तो बिल्कुल ठीक हूँ। और उम्रे वाले जरा और अच्छे होते हैं, वो खजूरें और पानी भी ले आते हैं। लेकिन वो जो डीकम्पनसेशन होती है वो कुछ हफ्तों के बाद होती है, ईद के 3 हफ्ते बाद, 4 हफ्ते बाद। तो व्हाट डू यू से, आई मीन आपकी ऑब्जर्वेशन में यही है कि
उसमें अच्छा असद, उसमें दो तीन चीजें। एक तो डेटा जो देखा गया है वो 4 वीक्स लेटर देखा गया है, उसमें चेंजेस देखी गई हैं। लेफ्टीज, अगर आपने मेरे जो हेल्दी अडल्ट्स वाली स्लाइड अगर आप याद करें, जो बिलिरुबिन बढ़ा था और जो EST बढ़ा था, दैट वाज वेरी हाई आफ्टर 4 वीक्स ऑफ फास्टिंग। तो वो डिलेड इफेक्ट आता है, थोड़ा सा ट्रांजिट है। दूसरा, जो सऊदी अरब के अंदर वहाँ पे मील्स हैं, जो वो खुब्ज और जो रोटी खा रहे हैं, जो उसमें सॉल्ट इंटेक बहुत होता है, तो स्टोर सॉल्ट और फिर वो डिकम्पनसेट करते हैं वहां पे। तो क्योंकि वो डिहाइड्रेट हो रहे होते हैं ना, क्योंकि वो फिजिकल एक्टिविटी हो रही होती है, बहुत ज्यादा तवाफ हो रहे हैं, तो वो उस चीज से जो है वो वाटर लॉस होता है। लेकिन वो जो सॉल्ट रिटेन करते हैं, दैट अल्टीमेटली एंड्स अप 2 to 4 वीक्स आफ्टर दैट एपिसोड के वो उनको हिट करता है। तो दैट्स व्हाट माय एडवाइस। अगेन, इसमें जो LFTs की डिरेंजमेंट वाला है वो तो 4 वीक्स की इसकी एविडेंस है कि बाद में लेटर ऑन आती है। माय पर्सनल एंड डॉक्टर जिसे कहते हैं ना एक्सपीरियंस इज दैट कि वो जो क्यूमुलेट करते हैं ना सॉल्ट, वो मैनिफेस्ट करता है।
अच्छा असद, एक क्वेश्चन है जी। जी असद, मैं चाहता हूँ आप पैनल में जो लोग भी हैं, आप सब जब क्लिनिक में रमजान में जो लोग जिनको हम कहते हैं वो रोजा रख सकते हैं, हमने नेफिल कहा, CHLPA है, कंपेंसेटेड, उनमें आप जो हमारा पाकिस्तान का स्टाइल है, मैं यूके की नहीं, मैं पाकिस्तान की बात कर रहा हूँ, कि जब वो आप इंटरमिटेंट फास्टिंग, एज वी सेड, इट्स बेनिफिशियल, माशाअल्लाह ज़ीशान हैज शोन अस द डेटा, लेकिन जो हमारे यहाँ पकोड़े और समोसे और जो इस किस्म की इतनी हैवी इफ्तार की जाती है कि उसका सारा बेनिफिट जो है, तो आई वुड लाइक टू आस्क ज़ीशान एंड योरसेल्फ एंड प्रोफेसर अल्ताफ कि आप कहते हैं कि यू हैव टू टेक फ्रूट्स and proteins and a very balanced diet for fasting and सहरी, ये आप कहते हैं, ये कुछ क्या क्लिनिक्स में आप?
मेरा एक बड़ा जिसे कहते हैं ना वो पेट जुमला होता है कि भाई अल्लाह ताला ने रोजे फर्ज किए हैं, पकोड़े फर्ज नहीं किए, ठीक है ना? तो आई डू एडवाइज देम, लेकिन जैसे अल्ताफ साहब ने कहा कि पेशेंट ने करना वही है जो उसको समझ में आना है, तो बट यस वी डू एडवाइज देम के डाइटरी जो है, ये पेशेंट्स जो कि खास डायबिटिक पेशेंट्स हैं या ये जो लिवर डिजीज पेशेंट्स हैं कि बहुत फैट इनटेक और बहुत ज्यादा सॉल्ट इनटेक ना हो, फ्रूट्स और जो है फ्लूइड्स का इस्तेमाल ज्यादा हो, इट्स जनरल एडवाइस फॉर देम, बट लेट्स सी सम ऑफ देम डू फॉलो.
Kamran, we will hear from Altaf Sahab also. My general advice, जो standard advice है वो ये है कि there is no such thing as, you know, iftari. You have to go for your routine regular dinner. आप खजूर पानी लें, नमाज पढ़ लें या जो भी है, just go for routine regular dinner, you know. And then अक्सर तरावियों, obviously तरावियों के बाद और इस टाइम 10 बजे 11 बजे you know होता है तो कोई फ्रूट सैलेड या इस तरह की चीज आप ले लें, बट देयर इज नो सच थिंग एज दिस इफ्तारी. वो पकौड़े समोसे, वो ज़ीशान वाली बात आ जाती है. आई डोंट नो व्हाट अल्ताफ साहब हैज टू ऐड.
I totally agree. You know, एक तो फैक्टर है कि these unhealthy evil foods, और दूसरा ये कि from filthy sources, you know, घर में भी नहीं बनाते, और स्टैंडर्ड इतना खराब होता है बाजार की चीजों का because of high demand. So not only bad foods but filthy foods which lead to a lot of GI infections, and our emergencies are filled with people having GI infections during Ramadan. So these are the two factors. So I totally agree. There is nothing special about Ramzan. आप सुबह जो ब्रेकफास्ट में खाते हैं वो सहरी पे खा लें, और जो खाना खाते हैं दोपहर को वो अफ्तारी पे खा लें, and maybe a bit of snack later in the night, and that is it. So you know, there is nothing special. कहीं जिक्र नहीं है, जैसे ज़ीशान ने कहा कि रोजे तो फर्ज हैं लेकिन पकौड़े फर्ज नहीं हैं. So one has to emphasize this. हम हर चीज अपने टाइम पर करें, अपना काम करते हैं, ये तो नहीं है कि हम दुकान बंद करके घर पे बैठ जाते हैं, you know. So take it in the true spirit rather than in the spirit of Gujranwala or Lahore. So I think आप खुद भी इसकी एग्जांपल सेट करें और पेशेंट्स को भी गाइड करें कि just eat normally, जैसे आप नॉर्मल डाइट लेते हैं, और अपने रोजे हेल्दी लोग जरूर रखें, सिक लोग ना रखें, and you know, follow general medical advice. Thank you.
That's very.
Thank you very much, sir. I think it's about time. There's no other question. I'll. G. Kiran, please. आप muted हैं.
इस्लामाबाद में आज लाइट का काफी प्रॉब्लम है. आई थिंक टीवी को बंद करने के लिए बार बार बिजली जा रही है. सॉरी. So we do encourage cases from spokes as well. So मैं आपसे फिर से रिक्वेस्ट करूंगी कि अगर आपको के अपने कोई केसेस हैं तो आप प्लीज हेजिटेट ना करें, और अगर आपको हमसे केस का फॉर्मेट चाहिए तो वी आर हियर और हम आपको प्रोवाइड कर सकते हैं और आपका केस आपके लिए प्रेजेंट भी कर सकते हैं. So we are grateful and thankful to Pakistan Society of Hepatology and Ferozan's Laboratories Limited for unrestricted educational grant, and our team at Parsa Echo Pakistan. Have a blessed Ramzan. Allah Hafiz. Uzair, you can call off the meeting.
Sure, ma'am. Allah Hafiz to everybody.